Why is the transformation zone important for cervical LEEP? Imagine the cervix as a gateway to the uterus, and right at this gateway lies a special area called the transformation zone. This zone is where the magic of cell change happens, and it's also where most abnormal or precancerous cells tend to develop. During a Pap smear or cervical screening, doctors look for changes in this area because it's the most common site for early signs of cervical cancer caused by human papillomavirus infections. The transformation zone is where the glandular cells of the endocervix meet the squamous cells of the outer cervix. This meeting point is dynamic, especially during puberty and hormonal changes, because the area can shift and change shape. When the body responds to these changes, the original squamocolumnar junction moves outward, creating a new zone called the metaphysician zone. This is why the transformation zone is considered the most active area for abnormal cell growth. In the context of the loop electrosurgical excision procedure, or LEEP, understanding and targeting this zone is essential. LEEP is a minimally invasive procedure that uses a thin wire loop heated by electric current to remove abnormal tissue. Because most precancerous changes happen within the transformation zone, removing this area can effectively eliminate cells that might develop into cancer if left untreated. It's both a diagnostic tool, providing tissue for lab analysis, and a treatment method, preventing progression to invasive cancer. Practically, during a LEEP, the healthcare provider carefully excises the transformation zone to ensure all abnormal cells are removed. This targeted approach helps reduce the risk of cervical cancer developing later on. However, it's important to remember that removing tissue from the cervix can sometimes lead to side effects, such as a slightly increased risk of preterm birth in future pregnancies or cervical stenosis, which is a narrowing of the cervix. In summary, the transformation zone is the key area where most cervical abnormalities originate. Removing this zone during LEEP allows for effective treatment and early intervention, which can save lives. That's why understanding its significance is so vital in cervical cancer screening and prevention. If you have concerns or questions about cervical health or procedures like LEEP, always consult a healthcare professional for personalized advice and care.